woman is admitted after being knocked off her bike. She has an open fracture of her tibia with 10 centimeter wound. No peripheral pulses are palpable. So this is the negative point, and which the wound is 10 centimeter. Intravenous antibiotic has been administered in the emergency department. Wound has been dressed. What is the best course of the action? That means the initial action is completed. That means the debridement of the wound and antibiotic intravenously they are given. In case of 10 centimeter wound and there is no peripheral pulse, that means there is the vascular abnormality. What may be our option? Here we can see immediate skeletal stabilization and application of negative pressure, intravenous antibiotic, photography and application of saline soap gauze with impermeable dressing, skeletal fixation followed by vascular reconstruction, immediate amputation, immediate vascular shunting followed by temporary skeletal stabilization and vascular reconstruction. So what may be the option? First of all, let's see the fracture type. The fracture type, they are classified in 3 groups, which is the type 1, type 2 and type 3, and it is the Gastilow-Anderson type classification. In case of Gastilow-Anderson 1, the wound is 1 centimeter, that means less than 1 centimeter. And in case of type 2, it is more than 1 centimeter, and the type 3, they are more than 10 centimeter. But there is difference that in type A there is adequate soft tissue coverage present. In case of type B, there is adequate soft tissue coverage not present. And in case of the type C, there is the associated vascular injury. So when there is the vascular injury, then it is the Gastilow-Anderson type 3C. Here we can see this is the grade 1, 2 and 3. Grade 1, it is less than 1 centimeter. Grade 2, it is 1 centimeter. More than 1 centimeter, and grade 3 it is the more than 10 centimeter, but they are subdivided into the 3A, 3B and 3C. The most worst is the type 3C because it is associated with the arterial injury. So what will be our option in case of a patient who is wound is more than 10 centimeter or 10 centimeter, but there is the vascular injury? So it is the Gastilow-Anderson type 3C. And what can we do? So what can we do in case of the patient who has 10 centimeter wound and there is no peripheral pulse? So what we have to do? We have to manage fracture, and we have to manage the arterial supply also, and we should ensure the blood supply fast because there is no peripheral pulses. So when this condition going on, the limb will be dead. So what can we do? We can do immediate vascular shunting followed by temporary skeletal stabilization and vascular reconstruction. So first of all, we have to ensure the blood supply by vascular shunting and temporary skeletal stabilization, because if a skeleton move here and there, in this condition the vascular shunting will tear off, and vascular reconstruction also. Other option here, such as the immediate skeletal stabilization and application of negative pressure, it cannot improve the blood vessel or vascular supply. Intravenous antibiotic, which is already given, so it is not be the option. A skeletal fixation followed by vascular construction. The skeletal fixation requires the definitive time, so within this time there is a chance of the limb death. And immediate amputation, here the time not discussed. So at least more than 6 hours requires after development of the compartment syndrome, but there is not such type of the fissure, that means the compartment syndrome. So what we can do? We can do immediate vascular shunting followed by temporary skeletal stabilization and a vascular reconstruction.